Thank you, Governor. Good afternoon, everyone. Thank you for being with us again today. As the Governor shared, we are continuing to see very disturbing trends in our data, particularly when it comes to new cases. Today is the fourth day in a week that we have had more than 400 new cases, and on one of those days, we had a percent positivity higher than 4%. What's important to know is that it is not too late. We can still change course. Really heed the steps that we're saying. We need to take the steps the Governor described, and we need to take them now. I want to reiterate them so that they are clear. Your number one message is to wear your mask whenever you're with someone that you don't live with, even if that's with extended family, with teammates, your faith community, your close friends, whether you're indoors in your own home or indoors someplace else, or if you're outdoors. You need to wear your mask if you're with someone you don't live with, and you need to watch your distance. Also, as the Governor said, limit social contact with anyone that's outside of your household. Keep your group small and consistent. Don't go shopping and have meals and get coffee or engage in other social activities with those outside of your small, stable group. And when you're with people in that small, stable group, continue to wear a mask and watch your distance. Stick to wearing your mask once you're with someone you're not with, and limiting to just essential activities, and continuing to take it outside, going to work, go to school, exercise, go to medical appointments, buy the goods you need, eat the meals, take it outdoors, and then return home. Keep your group stable, and no matter what you're doing, wear your mask. Make it as normal as brushing your teeth. You have to have your mask on if you're engaging with anyone that's outside of your household. There's no COVID-19 vaccine right now. The only way to stop the spread is by being accountable, being responsible, and acting to keep those around you safe. And we're giving you the tools to do that. This mask makes all the difference in the world. If we do these things, we won't have days like today where we're announcing 425 new cases. In addition to those cases, we have 136 people currently hospitalized. 18 people are in an intensive care unit, and 8 people are on a ventilator. We sadly have 4 new COVID-19 associated fatalities to report today. 1 person was in their 70s, 1 person was in their 80s, and 2 people were in their 90s. Our prayers are with the families of these Rhode Islanders. What more important way to honor them? By paying attention, doing things differently, wearing that mask and watching your distance when you're with anyone outside of your household. As the Governor shared, because these numbers have increased, because people have not been able to do that, but we know that you can, the system has been stretched. We're doing everything we will do to make sure that we adjust to that. We need you to do your part. We need that patience and kindness, understanding when the phone calls are made to us, wearing your mask, and then just knowing if you have symptoms, you need to stay home, members of your household need to stay home, and you can tell the close contacts around you that that has occurred. While you're waiting to hear from us, you are empowered with the information of what you need to do. Whether you need to get the test scheduled or not, you are empowered with the information. If you have symptoms, particularly a new cough, shortness of breath, or loss of taste or smell, those are the indicators most commonly associated with COVID. That's when you need to stay home, have people in your household stay home. Regardless of the time to get the test, that action does not change. And we'll continue to do our part. I'm going to take a minute to let you know what we're seeing in terms of our case investigations data. Between October 13th and 19th, we identified 1,708 new cases. While people between 19 and 24 years of age are still overrepresented in our case data, the case numbers are more evenly distributed among our different age brackets this week. It's still the 19 to 24-year-olds, it's the 30 to 39-year-olds, 40 to 49-year-olds as well. There's a general increasing trend we're seeing among people of all ages and in all communities, really driven by that same notion. Wearing your mask when you're in those comfortable, more casual, informal, unstructured settings. We can make that change, heed the data and the studies that show us that difference. We can stop this. Another trend we're seeing relates to work settings. Roughly 40% of our cases during the time period of the week that I mentioned, October 13th and 19th, were associated with work settings. 75 cases were associated with manufacturing, 64 with retail, and 58 with food services. We've also seen increases in office settings, such as financial settings and services. Our cases related to office settings almost doubled in a week, going from 48 cases to 88 cases. As the governor said, if you are in a decision-making capacity in a business, consider having people work remotely. Even in those work settings, the main concern or the main source of transmission is when people are in scenarios where they're socializing, their guards are down, and their masks are off. It's not the setting itself where there's structure and people are wearing their mask. We don't see cases transmitted to the same extent. So if people are going to work, masking is a must. The final point I'll finish with is to touch on the drug overdose crisis. Sadly, the drug overdose crisis is worse now than it has ever been. This is true in Rhode Island, and it's true in many other places across the country. Rhode Island's overdose numbers peaked in 2016 and then steadily declined over the next few years. Earlier in 2020, we started seeing increases. We're now on a path to exceed our 2016 total by more than 25%. In July, we had more overdose deaths than in any single month since we started tracking the overdose crisis. These are precious lives. The stressors and isolation of the COVID-19 pandemic have certainly contributed to these numbers. But we also started seeing increases in the first 3 months of the year before COVID-19 significantly changed the way that we live. Other factors that are probably contributing to the increase are polysubstance use, using more than one type of drug, and the presence of fentanyl in drugs like cocaine, counterfeit pills, methamphetamine, and other substances. Counterfeit pills, which often look like prescription medications, are in greater supply throughout the country, unfortunately. Just one of these pills, just one, can cause a fatal overdose. We want everyone to know that there is help and there is hope for everyone who is living with the disease of substance use disorder. BH Link is open and available. This is Rhode Island's 24/7 behavioral health hotline. If you call 401-414-LINK, 401-414-5465, you will get connected to trained professionals who can provide confidential counseling, referrals to treatment, and support services. People can also go to BH Link's drop-in center to get connected to support. It's located at 975 Waterman Avenue in East Providence. Additionally, fire stations in Providence, Newport, and Woonsocket are safe stations. They are open every day to help people in crisis get connected to a peer recovery support specialist and treatment and recovery support services. We want every door to treatment and support and recovery to be open to you. For everyone else, if you think someone is overdosing, call 911 immediately. The Rhode Island Good Samaritan law protects people legally who call for help. Also, carry the overdose reversal medicine, naloxone, also called Narcan, and know how to use it. Naloxone is available at pharmacies without a prescription, and it's easy to use as a nasal allergy spray as well. In the same way that we have the power to stop the spread of COVID-19, we can also prevent overdose deaths. These are two preventable health issues.